is functional medicine. And I want to start out by just explaining some things about our healthcare system so you'll understand where I'm going with this. So let's just talk about what medicine is. Now, I'm not here to bash medicine. I'm not here to bash medical doctors. They're smart people. They're sincere people. But let's just talk about medicine and what it is. So let's just say that, Mary, let's say you go to the medical doctor and you tell him, you know, I'm tired all the time. I'm fatigued all the time. So what do you think he would do?
Ask me questions, and he's going to give me probably some kind of medicine to help me sleep.
Okay. And he might do a blood test and check for anemia. Okay, he might do that. But if he didn't find anemia, there's really no standard blood test for fatigue, unless it's a thyroid issue. It could be a thyroid issue. But fatigue doesn't really have a test. You know, there's no test. We did the fatigue tests, and you're positive, you got it. You know, no test for that. Okay.
Right.
So let's say you're constipated, and that's by the way, that's a really common problem in our culture. I see it all the time. Is there a blood test for constipation? You go in, oh yeah, we're going to do the constipation test on you. Let me see that vein. You know, no, there isn't. There's no blood test for constipation. Okay, so what do you do what do you do then? What do they do?
Again, most of the time it's medicine.
Yeah, it's Miralax or whatever, and you know, and sometimes the patient does need to eat more fiber. They need to change their diet. What about anxiety?
Antidepressants.
Anti-anxiety medicine. Well, Wellbutrin, right?
Yeah.
Because there is no test for anxiety. There's no blood test where you test somebody. Yep, it came up anxiety. You know,
right?
You know, you're lucky you're not constipated. You know, I mean, you know, so there's a lot of problems that people have that have nothing or very little to do with the medical tests that are available, that are out there. And so what do you do with those people? What do you do with somebody that can't sleep? Somebody that just can't sleep. They don't know why. Is there a blood test, a lab test for sleep? No, there's no lab test for sleep. So what do you get? Ambien. You get a pharmaceutical, okay? So if we look at how a lot of medicine works, not all of it, but a lot of it, is you go in, you have a symptom. If they can do some sort of test for the symptom, they do it. If they can't test for the symptom, then what do you get? You get a pharmaceutical to treat the symptom. Okay, so let's just say, for example, that you can't sleep. Is there an underlying issue probably contributing to the fact that you can't sleep?
Yes.
Yes, okay. But if there's no lab test for that, then how do you figure it out? How do you figure out why you can't sleep?
I go to my chiropractor.
Okay, yeah, whoever that is. Okay, I hope you know a good one.
I do.
Okay, so that's where functional medicine comes in. So sleep is a functional issue. Constipation is a functional issue. Anxiety is a functional issue. A lot of times, fatigue is a functional issue. Now, fatigue can be an interesting problem, but here's the issue. Here's the thing that I want to say, is that anytime the body is not working, you're talking about a change in function, and we have to have a way of looking at that. That is a difference between functional medicine and regular medicine. Functional medicine says, how can we either test or evaluate this person to determine why their body isn't functioning? Now, let's talk about sleep and constipation for just a minute. What are some things that you could do without seeing me that might help that? That you, in fact, you could throw anxiety in there, and you may even be able to throw in fatigue into that mix. I'm thinking of a couple of things, specifically one thing that you could do for all four of those that might help all four of those things, and you wouldn't even have to see me, that would change the function of your body drastically. What would that be?
Exercise.
Yes, good job, Mary. Exercise. Exercise could help all four of those things. In fact, I would say this. There's nothing that you can do that will change the function of your body more drastically and more profoundly than exercise. You just did that. You could probably change those four things. Now, maybe not all of it, and maybe not 100%, but you could probably affect those four things. So what we want to talk about tonight is a whole discipline of what is functional medicine, how does it work, and how do I apply it in my office? All right, so let's look at the statistics right now. First of all, U.S. spends more on health care than the next 10 countries combined. We have less than 5% of the world's population. We take about 50% of the world's drugs, and we take 80% of the world's painkillers. 80%, okay? That's a lot, okay? So, you know that the people in Cambodia are getting shortchanged on painkillers, okay? According to the WHO, World Health Organization, the U.S. spends a higher proportion of its gross domestic product on health, but ranks 37th among 191 countries in effectiveness of healthcare system. Okay? So what's wrong with this picture? We spend a lot of money on healthcare and we ain't getting our money's worth.
Nope.
All right? The third leading cause in death is the effects of properly prescribed pharmaceuticals and hospital errors. It's the third leading cause of death. Now, for me, I'm just going to tell you, for me, I try and stay away from all pharmaceuticals, and I want to stay out of the hospital, okay? I never want to have to go to a hospital. It gives me the creeps to even walk in a hospital, if you want to know the truth. So we do some things really, really well in our healthcare system. Trauma care, really, really good. Nobody does trauma care better than the United States, okay? You know, we can fix certain problems pretty well, like cataracts. If you got a knee that's out, you know, a knee that's bone on bone, you get a knee replacement and or hip replacement, that can really change the quality of your life. But the world's leading medical journals have stated that we need change in this country. We pay more for health care than any other country, but we have unsustainable costs, poor outcomes, frequent medical errors, poor patient satisfaction, and worsening health disparities among different parts of the population. We need a transformative change. That came out of the New England Journal of Medicine, which is like one of the top 5 medical journals in the world. That was 2012. It says, unfortunately, many modifiable risk factors for chronic disease are not being addressed adequately. A prevention model focused on forestalling the development of disease before symptoms or life-threatening events occur is the best solution. How many of you in here believe that prevention is better than, an ounce of prevention is better than a pound of cure? Okay, I believe that. Okay, all right. So our current system does well with trauma care. If you have a heart attack, an accident, our system works well. But what about things like fibromyalgia, type 2 diabetes, chronic fatigue, or arthritis? Not very good for that, okay? So functional medicine is approach that we identify the causes of diseases rather than seek to treat the symptoms. Now, I am not saying here that you should never treat symptoms. Sometimes the symptoms are so bad you may need to treat them while you're finding the underlying cause. So I'm not saying you should never do that, but I'm saying this: if you can understand the origins of disease so that meaningful treatment can be implemented, then you can actually get people well. So functional medicine practitioners like myself ask two basic questions. Is there something in the body that shouldn't be there? Okay, like maybe parasites. Okay, where'd you get parasites, by the way?
Foreign holiday.
Yeah, bad water. Okay, yeah, bad water. You can get them from pets.
Yeah.
You can get them from your dogs and cats.
Yep.
Okay, hidden bacterial or fungal infections, toxic chemicals, heavy metal toxicity, toxic fatty acids. Where do you get that? Toxic fatty acids. Where do we get that? Anybody know what I'm talking about there? Anybody in here ever eaten French fries?
Yeah.
Oh, you're getting toxic fatty acids, believe me. Anybody in here ever eaten chicken nuggets?
Mm-hmm.
Oh, you're getting toxic fatty acids. Absolutely. That's where you get them. Okay. Structural imbalances. That's a chiropractic issue. Medication side effects. Food intolerance such as gluten, dairy, or soy. Let me tell you about we'll get to the medication side effects in a minute. Toxic emotions such as anger, greed, resentment, or unforgiveness. Do you think that could cause a problem in an individual?
Yes.
Oh yeah, absolutely it could. So, or is the body lacking something that it needs? Okay? Trace minerals, specific vitamins, phytonutrients, enzymes, probiotic, exercise. We just talked about that. Diversity of gut flora, positive relationships. Maybe this is what you need, okay? Maybe it's not so much what you lack or what you have that you don't need, it's what you're lacking, okay? So are the health issues we face in our civilization pharmaceutical deficiencies? Okay, so 1 in 10 Americans take an antidepressant, okay? So if you go to a mall, you go to a parade, which nobody goes to anymore, because we have mask deficiencies, that's why we get COVID, or we have social distancing deficiencies, so we get COVID. So could it really be that 10% of our population was born with a Prozac deficiency? No. A Prozac deficiency is not what causes depression, okay? We'll talk about that in a little bit more. So how would a functional medicine practitioner like myself evaluate something like chronic depression? Okay, so what's causing the brain to malfunction? Could it be trapped emotions? Okay, now I do an entire talk on emotions where we talked about how emotions can get trapped in certain parts of the body and just sit there and vibrate and cause problems, okay? We'll do that another time. Food intolerances, gut flora imbalances, could that be a cause of depression? Like what? What kind of food might cause it?
Sugar.
Sugar, yeah, too much sugar causes the brain to not work right. What other food right off that we absolutely know scientifically can contribute to brain dysfunction and depression? Sugar's one. How about gluten? Gluten's another one. So heavy metal or other toxicity. You know that lead and mercury tend to settle in the brain. Lack of sleep. Somebody that's chronically sleep deprived, will they be depressed? Man, I sure get depressed, sleep deprived.
Mm-hmm.
Right.
Poor cardiac function, fatty acid imbalance, elevated blood sugar, okay? All of those things. So if somebody comes in and they're depressed and they don't know why, those are some of the things we might look at, okay? So let's look at statin drugs. One of the most commonly prescribed statin drugs, 30 million take them, are for cholesterol. So the problem with statin drugs is they prevent, let's see, did I miss a slide? No. Statin drugs just don't lower cholesterol, but they cause biological compounds not to be produced in the body. Like, for example, vitamin D, coenzyme Q10, sex hormones. So is vitamin D, anybody know what problems that might be associated with? Low vitamin D.
Not enough sun.
What?
You're not getting enough sun.
Okay, but okay, that's true, okay? But what would the effects of low vitamin D, what might they be? Anybody know? Depression is one. Here's another one. Immunity, low immunity, okay?
Yeah.
So, do you think that everybody should have their vitamin D checked if they want to avoid COVID? The answer is yes, because if you have low vitamin D, you're more susceptible to COVID, and I can show that in two journal articles. So yeah, so here's the thing, 30 million people, 1 out of 10 Americans approximately take statins. Is that making them more susceptible to COVID?
Yeah.
Probably, okay? So, were they born with a statin deficiency? Were they born with a Mevacor or Lipitor deficiency?
No.
They just, oh, this baby, they've got a Lipitor deficiency. I can just tell, No, they weren't. Okay? So let's look at the typical side effects of statin drugs. There's a lot of them. Muscle joint pain. So if somebody comes into me and they've got a lot of lower back pain and taking a statin, first thing I'll do is say, that could be the pharmaceutical you're on. That might not even be a mechanical lower back pain. Memory loss, no energy, okay? Loss of sexual libido, low testosterone, diabetes, increase in overall death rate. All of those are side effects of statin drugs, okay? So what might be, I got to get going on this because run out of time here. What might be the cause of high cholesterol if it's not a statin drug deficiency?
Food you eat.
Yeah, the food you eat. Exactly. We won't get into that, but I'll give you a hint. One's sugar. So, let's say you're having a stomach issue, okay? Heartburn. So, most doctors would prescribe one of these, right? Okay.
Yep.
So, it's a Prevacid deficiency. Yes, your heartburn. It's a Prevacid deficiency, I can tell. Okay. So, a functional medicine practitioner would look at low stomach acid, enzymes, food intolerances. I look at all of this stuff. Now sometimes GI issues are hard to figure out because it's, if you've got H. pylori infection, you need to do a stool test on that and find that out. And I just did one on a guy recently who had chronic stomach issues. His H. pylori was really high. That was it. No one had ever done that on him before. So we're working on that. So it's like an iceberg. The symptoms are above the water. The underlying causes are that huge portion below the water. So as a functional medicine practitioner, these are clues. These are causes. Okay? So William Osler, who's the founder of Johns Hopkins Hospital. Anybody here heard of Johns Hopkins? Pretty famous, yeah? Osler's pretty famous, actually. He said he was really thought like a functional medicine guy. He said the good physician treats a disease, the great physician treats the patient who has the disease. It's more important to know what sort of patient has a disease than what sort of disease has the patient. Pretty interesting, okay? Another important saying by Osler, this is so true, if you listen carefully to the patient, they will tell you the diagnosis. This is why case history is so important when you're working with somebody. You can't, if somebody's coming in and they've got 6 or 7 pretty big symptoms, you can't in 5 minutes or 10 minutes listen to them and say, okay, you got this, this, and this, here's what we're going to do. You cannot do that. You will not get that patient well. So you have to listen carefully to what they're saying. Let's look at some case studies, okay? So these are case studies in my office. This is a 40-year-old female who came to see me. She had daily stomach pain, which is getting more frequent, alternating constipation and diarrhea. Stomach pain so bad that caused her to lay down in bed most of the day, many days. And she had past gallbladder removal and anxiety and depression. Okay? So, pharmaceuticals. Oh yeah, she had a Prilosec deficiency for 10 years, okay? So, what did I find on her? I just did an evaluation, an in-office evaluation. And this particular woman, I didn't do any lab work on at all. Because I didn't have to. She had a hiatal hernia. She had an ileocecal valve dysfunction. Ileocecal valve is a valve between the large and small intestine that lets food through. So that valve is stuck open or closed. Guess what? Your GI system's not going to work right. She had low stomach acid production, low pancreatic enzyme production. So I fixed her hiatal hernia, gave her, she had to have bile salts. If you've got a gallbladder removed, you have to have bile salts. You'll never be normal otherwise. I gave her Pepsin stomach acid supplement to replace the stomach acid that she didn't have. Bitter herbs to stimulate digestion. The results, stomach pain is much better. She still occasionally has mild pain. More energy, better focus. She no longer needs bed rest because of her stomach pain. Okay, so she has like 6 kids. So she's got, do you think someone with 6 kids has a lot going on?
Yeah.
Yeah. I mean, I don't have one, so I can't imagine 6. Okay. Bowel movements, much more normal. So that's one case. Here's another case I had. It's a 71-year-old female. She had a lot of stuff: chronic fatigue, fibromyalgia, anxiety, depression, suicidal thoughts, poor digestion, constipation, poor memory. You think this was a happy camper? No, she was not. All right. So here's what my find. Now, I did a lot of testing on this woman. Multiple food intolerances. Low B vitamins, especially inositol. Inositol is important for brain function and for sugar metabolism. She wasn't converting her thyroid hormones very well. She had fatty acid imbalances. She had a very, very high arachidonic acid EPA ratio. You're going, what the heck is that? Usually people that have the EPA is your omega-3 fat, okay? So somebody that has a very high arachidonic acid ratio and very low EPA, those people are usually depressed, okay? Why? Because EPA is one of the major constituents of your brain. And so the higher that ratio, arachidonic acid to EPA, there's people that have it when it's really, if you look at people like that do serial murders, that have that, a lot of our prison population have been tested, very, very high AA EPA ratio, okay? So the higher, the more that spreads apart, the more your brain isn't going to work right, okay? Very low vitamin K, and she had vitamin D insufficiency. So this is what I found. So here's what her past history was. She had appendix out, thyroid cancer, failed low back surgery, bipolar, multiple auto accidents, abusive family relationships. Here's the drugs she was on. Some major clonazepam, major psychiatric meds, okay? So here's what I did. I corrected her nutritional deficiencies. She stopped eating the food she was intolerant to. I gave her Brazil nuts to increase selenium, which helped her thyroid conversion, and did some very low chiropractic care to relieve her back pain, which was chronic due to failed back surgery. So results, suicidal thoughts went away in about 3 to 4 weeks. Depression improved. Back pain improved. It didn't totally go away, but it improved. And she was able to decrease some of her medications, okay? Did I get her completely well? No. But someone with this many issues and on chronic drugs like that, you're not gonna get them off all their meds, and they're not gonna be 100%. But she was a whole lot better after that. Now here's the last one. This is one I saw several years ago. I still run into her mother occasionally, and her mother just loves me because she feels like I saved her daughter's life. This is a 13-year-old girl. She contracted mono 12 months before she came to see me. And then she contracted the flu over the following Christmas. So I started seeing her in about probably March or April, okay? This is several years ago. She developed the following symptoms. She had to drop out of 7th grade, okay? Daily migraine headaches, persistent vomiting, chronic fatigue, daily moderate abdominal pain. Now, when I was in 7th grade, which was back in, I think, like 1966, back when I first saw my first T-Rex, it was a long time ago. We didn't have I didn't know many students with these issues. I just didn't see that. Yeah. And so she's dropped out of 7th grade. Her mother is going to take her to Mayo Clinic, but somebody told her about me. She said, well, I'll just try that, and if that doesn't work, I'll go to Mayo Clinic. So I didn't do any lab work on her at all. None. This is all in-office work. And the reason I didn't is because her mother had just gone through a big divorce. She had no money. She couldn't do lab work. She barely do the supplements I recommended. So I found that this girl had significant autonomic nervous system imbalance. She had food intolerances, and she had adrenal fatigue. That's what I was able to find in my office. Okay. So I gave her low force chiropractic. I took her off the foods that were causing her intolerances and desensitized her to those foods. And I gave her specific nutritional supplements to help heal her GI tract and to help her lower her fatigued adrenals. So, results: migraines improved. They didn't go away, but they improved. Okay, I only saw this girl for about probably 5 or 6 weeks. That's all I saw her. Okay, stomach pain and vomiting went away. Got her energy back. She was able to go back to school and finish the 7th grade. She was able to go on an overseas missions trip the following summer. Okay, so do you think her life changed?
Yeah.
Yeah, it did. Yeah. And so with this particular case, this girl, because of her age, kids bounce back a lot faster than, a 55-year-old that's been in 3 car accidents and, eats like crap and, doesn't have a healthy lifestyle. This kid's gonna bounce back a lot faster. She did everything I asked her to do. Her mother did everything that I asked her to do. And so now, she wants to be a natural health care practitioner because of how I helped her. So these are 3 cases. I could have put up a whole lot more cases. I had another case that came in to see me, she's 18 or 19-year-old college student who had all kinds of GI issues, fatigue issues. This was probably early in the summer. I did a comprehensive blood test on her is all I did on her. Gave her the supplements, did some in-office testing. I didn't do any chiropractic on her. And I think I saw her twice after that, and she's doing great now. She had no issues at all. Now, I wish everybody was like that. Not everybody does that well, okay? But those are examples of people that you can help with functional medicine that are not going to respond to medication. And so here's what I'm saying. Who do you know out there that's sick, that's unhealthy, that's not getting well, that has problems, chronic problems, their life is being altered? Who do you know like that? Because chances are we can help them here. I can help those people, okay? I may not be able to get them 100% better, but let's say you can get 80% of their life back. Is that worth it to them? There's a lot of people like that They take med after med, medication after medication, and they never get better. So I would say this, tell them about our office. Tell them what we do. And at least they could come in and talk to me. You know, if I can't help them, I'll tell them. But chances are that if they've had all those failures, that maybe nobody's ever looked for the underlying cause. And that's what we do here. We look for cause. I never treat symptoms. And some people don't like that. You know, they want me to treat their symptoms. And I'm not saying symptoms aren't important, but we need to find what is the cause of why they're sick, and let's fix that. So if you know those people, which I'm sure you do, you can talk to Carmen. She can help get them scheduled, and maybe we can help them. So it's just a little after 7. Thank you so much. I hope you learned some things about what functional medicine is and how that's different from regular medicine. We use a lot of the same tests that they do. We go beyond that. We use even other tests that they don't use. We try and find the cause, and we try and fix that. And you know, if we can do that and get the patient healthy and well, great. Good. Thank you so much.